To start, before we start, we just say Al-Fatih. This is Alhamdulillah. My name is Popoola. I'm a pharmacist by profession. I'm here today to kind of share my knowledge regarding pain management. So pain, as we all know, it has a negative connotation. If people say the word, if you hear the word pain, you always attribute it to something negative. But you know, in terms of one's health, pain is a very important terminology in healthcare. In terms of how we feel, in most of the illnesses, one of their symptoms is they will mention, I've got pain. That's what they use to detect or to diagnose if someone has any problem. So this topic is very broad, but I've just kind of made it very simple so that everyone can understand the basis of what pain is all about. So I asked the question, is pain a good thing? And there's a young lady here who saw it and she was laughing and she said it's not a good thing. Is it? But the importance of pain, you know, when you touch something hot, I mean, if you don't feel it, then you know, you damage your organ because of that. Or if you take something that is very cold, extremely cold, like you notice people who go to the attics, they lose their limbs. Why? Because of the extremity of the temperature. And one of the ways they can tell that, you know, that their skin is exposed to something is through pain. So pain has a very important, is very important for us to be able to tell what is going on around us. So in that sense, pain is good. But for most of us, we see it as something negative. So if it's now too much and become unbearable, then it is a problem that we need to now manage. So in definition, pain is one of the body's defense mechanism. It helps us to detect it as a problem and to prevent any further damage. So like what I explained earlier, if you take something that is very hot, it will pain you, so you know you drop it. So it's a way of, especially for like children, even for us adults, as we grow older, sometimes you're doing things subconsciously and you just hit something like iron or something. You know, maybe you're on the phone and you're ironing clothes at the same time. It has actually happened, someone taking the iron and you know, you know, so that pain he felt, you know, oh, I'm doing the wrong thing. The person is trying to multitask. So they say we feel pain because the body tries to tell us something is wrong. So that's why for us medical professionals, if you come to us and say you've got pain, what we try and do is establish how long we've had the pain and how severe the pain is. That can give us an idea of if it's a serious problem or a mild problem. Okay? So we've got different categories of pain. We divide into two, which is acute and chronic. So acute is the one that is kind of mild. It just happens all of a sudden. So maybe you hit something and then you feel the pain, and then you just, maybe after a period of time, you still feel the pain there. So maybe there's a bump, and then you know that, oh, I've got a pain. So that's acute. Within a few days, that should resolve. But then there's what they call chronic pain, where the pain comes from kind of inside within your body. So it gets worse over a long period of time. Instead of it getting better, it's getting worse. So for us, we always say that is a serious problem, and then you need to go and see your doctor, who will now try and diagnose why you have the problem. Okay? So the chronic pain, an example is you're having like trembling pain, or like someone that's got arthritis. You know, they have swelling knees or the back is very painful, so they can't even walk. So that's a very chronic pain. Instead of the pain getting better within a few days, it's getting worse. And such situation, we always advise people to go to see their doctor. Okay. So how do we? This is just a diagram to show why we perceive pain. Okay. I don't know if you've been taught this in biology or in science. I'm sure you've seen something like this during your days. Obviously, we've got the area where you have the injury, which is below this area. So once you touch anything, okay, so once your body, this is like your skin. So if you touch anything sharp or anything drops on your skin, what tends to happen, there's a transmission of electrical impulse which goes through the nerves, and that is transmitted to your brain. So it's when it gets to the brain that the brain now interprets it as pain, and then you react to it. While there's electrical impulse there, sometimes they release what they call mediators, so things like prostaglandin. That is a chemical secreted by cells in the body to indicate that there's a damage. So that's what now results to swelling and redness in that area. So if you hit something very hard, you notice that the area begins to swell after some time, and it looks red. I know we are black, so we won't tell very quickly. But if like a white person that hits, you will see that area will be very red. You understand? That redness is due to things like prostaglandin. Is the body's way of reacting that there's a damage in that, showing that there's a damage in that area. Okay, so that's what I just explained. That at the same time, the chemical called prostaglandin is released from these tissues, and that shows that area is damaged. So that results to redness and swelling, and also you feel very painful in that area. Okay. So there are different kinds of pain. I don't know if I would say it ranges from headache, dental pain, period pains, joint pains to back pains. So there are different kinds. People come with, especially when you've got things like cold or flu, you experience pain all over the body. So we try and analyze how bad the pain is. Obviously, in some hospitals, like if you have a chronic pain, they have a scale for you to tell them how severe the pain is. They will say on a scale of 1 to 10 how bad the pain is. So the way I take pain and the way you take pain is different. Some people, the slightest pinch, it's a big worry for them, and some people it doesn't, until it is very dark, you can actually notice that there's something wrong with this person. They won't feel that they've got pain. So in terms of pain management, it's very subjective. You understand? So you have things like headache and migraine. That's the most common kind of pain that we are always presented with, and which we can treat within a pharmacy setting. There's the dental pain. So for some people, they have like tooth decay, and when that happens, if you eat anything, you notice that there's a sharp pain. And I can tell you, most people, they always say that apart from labor pain, which the women experience, the next one is the dental pain. I don't know if anyone has experienced any severe dental pain. So if the back of your molar is broken or is exposed, you could have that trembling pain all night. That is one of the worst pain one can have. But obviously, within the pharmacy, there's nothing much we can give. All we advise is go to the dentist and sort the teeth. And that's why the dentists make so much money in this country. Because, they know that without them, a lot of people will be in trouble. Okay? So obviously, in terms of preventing dental pains, all we advise is you try and have a good oral hygiene. So the advice is you brush your teeth twice every day, morning and night. Okay, especially with the kids, we try and encourage them to do that from a very young age. Okay, because what happens is overnight we are exposed because we eat, and then at night over the it's about 6-8 hours you're sleeping, so that's when the bacteria in the mouth have time to cause the tooth decay. So that's why we encourage people to brush at night. As a matter of fact, brushing at night is more important than brushing in the morning. You understand? Because the whole idea is to reduce the amount of food and sugar there, so that you don't have bacteria feeding on that, which now causes gum infection, and you having like a colored teeth. Okay, so just to prevent dental pain in the long run, you try and maintain a good oral hygiene. Then we've also got period pain. For women and young women, this is something that they experience every month. It's not something that can be stopped, but we've got most women will know what tablets to take to help reduce that. Okay. Then we've got muscular or joint pains. So maybe people that do a lot of sports or do workouts, if you do it too much, that can result to you have what they call overuse pain, or you can have a strain or sprain. You understand? So you get like the joints swelling, or you notice that maybe after waking up the next morning, you can't walk properly. Because especially you notice that if you've done exercise, if you haven't done exercise in a long time and you now do one, the next day you start having pains all over, and that's due to the fact that you haven't used that muscles. So that's why we advise that if you're doing an exercise, maybe if you haven't done exercise for a long period and you want to start doing exercise, you do it gradually. You don't do too much initially, because that can result to you having sprain or strain and causing pain. Okay. And also, obviously, there's some people experience what they call osteoarthritis, which is it's an autoimmune disease. So it's more common with the elderly. You notice that some people, as they grow older, they begin to walk in a funny way, or they limp. It's just due to wear and tear of the joints, And at the moment, science is trying to find ways of relieving or improve their quality of life. So there's things like hip replacement, knee replacement that you hear nowadays. It's just because what happens is that the joints, there's the tendons and the muscles, the bones there, rubbing on each other. So that causes them to have a lot of pain. That's why you see some of them using things like walking stick. So what they do now is they do like a knee replacement. So they just put like a shield between the two bones so that they don't rub on each other. And if they're lucky, that will work well for them, and they won't experience pain anymore, and then they can have a better quality of life. A lot of people are always afraid of operation, especially from our culture back home. But at least I've witnessed quite a few people that have had knee replacement or hip replacement, which has worked for them. But then at the same time, there are some people that it didn't work for them and they died in the process. So it's a 50-50 kind of thing, understand? But I think the success rate in this country is high now compared to before, you understand? So it's something what, if you know anyone that is skeptical about that, you can just advise them to see their consultant, who will be able to give them a true diagnosis to say, if it's worth doing or if it's not worth doing. Understand? And then there's also the back pain, which is it's not the commonest kind of pain, but that back pain is one of the kind of pain that makes people call off sick a lot. Obviously, in this country, we do a lot of hard work. People stand or they sit in front of the computer for too long. That can result to back pain. We drive long distance. That can result to back pain as you get older. So it's quite important that you try and find out a good posture whenever you're doing something which involves sitting for too long or standing for too long. You try and balance it out so that you won't strain the muscles at the back. You understand? So I'll discuss more on back pain later. Does anyone have any questions or anything to chip in at this point?
Maybe just to ask, what are the reasons why some people don't want to feel pain at all, and without them having to do or go through any strenuous exercise, they tend to take painkillers on a regular basis. What are the pros and cons of those?
Yeah, I mean, at some point when we're doing the management, I'll mention the overuse of painkillers. That's why I said pain is something subjective, so it depends on the individual. I always advise that don't take painkillers unless it's extremely necessary. Some people just feel a little pain here and then they have to take painkillers. But what happens is if you take painkillers too often, that can result to you having pain. Because what the painkiller is doing is masking the pain. It's just when you take the painkiller, you won't feel it at that point. But if the problem is still there, the pain will come back later. Once the tablet has worn off, you start feeling the pain again. You understand? I know some people have chronic disease like arthritis. They have to take painkillers. But even with such people, I still advise them to. There's paracetamol, which is the safest painkiller to use, so long as you take it as prescribed. So I always advise them to take that one over other painkillers. You understand? But I still advise them to take it only when it's necessary. If they don't feel that they need it, then there's no point taking it. You understand?
And the second one is, I don't know if we're still coming to migraine.
Yeah, we're coming to migraine.
Okay.
The next topic is migraine.
Okay.
Yeah. So there's a lot of different types of headache, and there's no single cause. We've got what they call tension headache, which is the most common. So obviously that's mainly due to stress, anxiety, or if you're straining your eyes, maybe you're reading somewhere that there's not enough light. You notice after some time you start having headache. So, and also bad posture. So if the way maybe you're traveling long distance and the way you sat wasn't good, it could result in you having like a tension headache. Okay. So tiredness also causes tension headache. Okay. So another type of headache is the sinus headache. That's more common during the cold and flu season. So when people are coughing, they have blocked nose, then because of the fluid in there and because they are sniffing their nose a lot, that results to them having headache. Okay. So obviously, the way we treat that is give them something to decongest the nose and a painkiller also with that. We've got also what they call cluster headache, which is it's a very severe pain that happens on one side of the head. Okay, but this is uncommon, but when it does happen, it's very, very, very severe. Okay, and there's also what they call hangover headache. Hangover is for people that drink alcohol. So because of drinking too much alcohol, that causes them to have headache. And one of the reasons is because when you drink a lot, your body because it makes your body dehydrated, so you need to drink water. But because of the state they are in, they can't maybe do that because they've intoxicated themselves. So that will result to them having a headache, and that kind of headache is called hangover headache. And there's also what we call medication overuse headache, which is what I mentioned earlier. So as a result of taking too much of painkillers, once the tablet wears out of your body, then you start developing headache as a result of overuse of painkillers. So that can result to you not having headaches also.
Can I ask a question, please?
Yeah.
What's the causes of the cluster headache?
Cluster headache, it has different causes, because it's more on one side. It could be maybe the person didn't eat on time, or there's a hormonal change, or maybe the person didn't sleep well during the night, you understand. But a cluster headache is slightly different from migraines in the sense that with migraines you have other symptoms with the headache. Because some people have just one side headache, but then they say that's migraine. If it doesn't come with vomiting or feeling sick or like dizziness, then that is more of a cluster headache. Okay. So the next one is the migraine, migraine is a kind of headache, but it's a more severe headache. Okay, and it's always associated with, either you feel like you want to vomit or you actually vomit. Some people actually vomit if they have the headache. Some people, when they experience that headache, unless they vomit, the headache will still be there. So they have to try and make themselves vomit, so that they feel better. You understand? Some people, because of visual, when they have the headache, they can't see properly, or the moment the slightest noise, or they can't stand noise, they can't stand being in a bright room like this. So most of the time, they're always advised to wear like a dark glasses when they have that kind of headache. Okay, and according to the Migraine Trust, it affects over 8 million people in the UK, with over 190,000 cases of migraine attacks every day. So it's quite common, especially in this country where there's a lot of stress, there's a lot of situations that would trigger people having migraines. Some people, when they have the migraine, it could make them, they won't be able to do anything for a week. Some people, it makes them just stay indoors for a whole week. It could be that bad, But such people, you always refer them, the doctors will always refer them to a consultant who would help them manage their condition. You understand? So, but, excuse me, most people will know what triggers their migraine, okay? Because, as from experience, you will know that if I eat this, it might make me have a migraine, or if I don't eat all the time, you will know with yourself that, yes, these are the things that will make me have the headache. So the best thing is just to avoid such situations from happening. Okay. So there are two main types of migraines. There's the classic and the common migraine. The classic one is the one that comes with what they call aura. So aura is just nerve symptoms. That's what I class it as. So you won't be able to look in bright lights. You might be seeing zigzag, or you feel like pains on your arms. You understand? And then some people, they can't even speak properly if they have that the migraine at that point in time. Okay. And there's the common migraine is the one that there's no aura, so the person feels sick, or if he looks in the light, then the headache will be more. That one is just a common one. But if there's like zigzag, or they can't see properly, they can't speak properly, or they're having pains at the extreme of it could be the hands, it could be the legs, then that's a classic migraine. And the doctors, most of the medications for this are on prescription. You understand? Although there are some tablets available over the counter now for migraines. But with this, you have to speak to the pharmacist. So the key things that trigger migraines are things like food and drink. So some people, if they eat cheese or chocolate, they get migraines. You understand? So some people, if they take red wine, it makes them have a migraine. Okay. Then there's some people, if due to the change in routine, so if you are the type that have shift job, for instance, so if you don't sleep properly, it will result to you having tiredness, and that can even trigger a migraine. And even doing too much exercise can cause a migraine, and also eating too much, eating too little can result to having a migraine.
What about
The weather. Yeah, It depends. If it's a very bright weather, some people it's maybe because due to the brightness. That's what triggers the migraine. So for such people, it will be a problem.
Like a sudden change of weather from hot to
Cold, exactly. Then obviously during the hay fever season, some people have allergies, but because they have the allergy and they're sniffing and all that, with the sun, it can trigger their migraines. You understand? So it's a combination of things that could, also trigger their own migraine.
What about drinking coffee or cheese, eating cheese?
Eating cheese, that's what I'm saying. So that's why I said, for every person that suffers from migraine, as they go along, they will notice what triggers their migraine. So the best thing is just to avoid it. These are the common, I'm just mentioning the common things that cause one to have migraines. So things like cheese, chocolate. So if you eat anything with chocolate, it's not like everybody, I could eat it. But then somebody that has migraine, he knows that if he eats it, it's trouble for him. So we advise that person to be, what they do is, if someone is having migraines quite regularly, they get the person to have like a diary to track what he's doing. So from that, they can now tell, oh, these are the things that are causing your migraines. So try and avoid, those things basically that will trigger it. Okay.
That's what you mean by sleep pattern.
That's what I mean. Like people that have shift job, for instance.
Okay.
So for instance, they don't sleep during the night, and then during the day when they are supposed to sleep, they cannot sleep. So after a few days, they begin to have headache or migraine. Some people will start having migraines as a result of that. So, or maybe when you were supposed to sleep, you didn't sleep. If anything can affect that. So even with the weather now, you have to wake up should be very early in the morning, and then going back to sleep might be a problem. I have that kind of problem myself. So, that can affect your sleep pattern and then result to you having a migraine. Okay. Then there's also hormonal changes. So like if a woman becomes pregnant or if she gets to a menopause state, sometimes that can be what would trigger their migraines at that point in time. And there's also emotional changes. So things like anxiety. If you're very happy, sometimes it could result in you having a migraine. If you're too excited, and also depression is something that can cause people to have migraines. Then also there's some medicines that can trigger migraines, things like contraceptives, hormonal replacement therapy. So for some women, when they're in their menopause, they give them what they call HRT to help them during that period. So for some women, that can trigger their migraines. Okay, and some sleeping tablets also cause migraines. So one should always be careful. There are other external factors like noise and flickering lights. So like if sometimes the bulb, especially with fluorescent tubes like this, begin to flicker. For some people, that can trigger their migraine. Does anyone have any questions on migraine? You're too young to have one now anyway. Are you clear on the migraine?
So, for somebody like me, I only drink a decaffeinated tea.
Okay.
If I drink the normal tea, I only give me a headache, I don't get to sleep.
Okay.
Or since I've been drinking the decaffeinated tea, I see the difference.
Yeah.
It's the same thing applied to coffee.
Coffee,
But I don't drink coffee too much, once in a while. So if you drink coffee every day, does it have any effect?
It depends on when you drink it. I mean, some people, they drink it at all because they're problem. You understand? But for you, for instance, do you drink it in the evening or do you drink it in the afternoon?
In the morning, most of them.
In the morning?
Yeah, in the morning. Well, not every time, maybe once in a week or once in a month.
Yeah, it's not. I mean, you know yourself.
Yeah.
If, for instance, if I drink tea or coffee in the evening, I'm looking for trouble because that means I'm not going to sleep.
Are you a Muslim business owner or charity? Are you looking for ways to reach your target audience and increase sales? Then look no further. Salam Africa Television is the perfect way to advertise your events, business, and services, corporate or private. We can help you reach millions of potential customers in the United Kingdom and around the world. Our rates are considerate and humane. Call us today on 00447903261385 or send us a mail. Advertise@salam-tv.com. We are waiting. Salam Africa Television is a dedicated Muslim channel for the promotion of African Muslim and Islamic messages to the world. Salam Africa Television prides as the most prominent ethnic televised medium. We cover Muslim events, affairs, business, and lifestyle. Educative, informative, while furthering better participation and inclusive opportunities to promote the views and activities of African Muslims. We provide the young Muslim generations an alternative source of information of truth and pure Islamic knowledge from the Quran and the authentic Hadith sources. Salam Africa Television makes accessibility to our programs easy for everyone world over. This is why we have specifically chosen to stream our programs live online. With focus on capturing the millions of viewers from around the world, we broadcast live, 24/7 each day to a global audience in 136 countries. With viewers from a wide array of nationalities and cultures. Salam Africa Television's clear aim is to inform, educate, and entertain its viewers with innovative and cutting-edge Islamic programs. Salam Africa Television, perhaps, they may reflect.
You understand? So, you get to know yourself. But if I drink it in the morning, it's no problem. But if I drink it in the afternoon, evening, no sleep. So, and that can now result to you having been tired, and that can trigger you having headaches. So that's probably why you're having the headache, because you didn't sleep well. And then, when you do wake up, you start having a headache and stuff. You understand? So if you want to drink, what I advise people generally is drink tea decaffeinated, especially in the evenings or in the afternoon. It's better that way. Okay. Any question? You got any migraine?
Management of our migraine.
Yeah. With the migraine, there are different types. I'm going to mention a few things about it, be a summary. But with migraines, the key way to manage it is to avoid having it in the first place, because once you have it, it will knock you out for a few days. And most people that have migraines, they know what it entails. Usually with patients that complain of migraine, or someone comes first time migraine, we cannot sell them anything for migraine unless the doctors diagnose them with migraine. You understand? So we'll just give them normal painkillers, but to be honest, normal painkiller doesn't work for them. So something like paracetamol, ibuprofen, it doesn't really help most of them, to be honest.
So what about this antidepressant dependent?
Some people, it might help them, you understand, but those that have what real migraine, it doesn't. It might help take the edge off, but they'll still be feeling, I said it's not just the headache, you have other nerve symptoms that come with it. So like they'll still be feeling sick, they'll still be having the tingling feeling. So they use what they call somatriptan, which is what's the name again? Immigrant. That one, but you can only buy that through a pharmacy, and usually we would ensure that the doctor has prescribed it for you before we can even sell it to you. You understand? But the best way to manage migraine really is to avoid the things that trigger your migraine.
And what are the, should I say, symptoms? How do you distinguish between migraine and normal headache?
Like I said earlier, the headache is just very severe pain in your head. With migraines, you have that same headache, but with that, you feel like you want to vomit. You feel like it comes with other symptoms. You won't be able to look in the lights, or you might even be, when you look at like this picture, you just be seeing zigzag. Some people have it like that. You understand? And some people get pains in their tip of their finger or their feet. You understand? So that's how you distinguish between the two, really. Okay.
Proceed.
Okay.
Alright,
Um, like I explained earlier, back pain is one of the most common cause of absence from work in the UK. It's not the most common compared to headache, but because obviously at work it involves a lot of sitting, standing, carrying, lifting, So in doing obviously those routines every day, 5 days a week, every week for a year, it can affect your back. So I'm sure if your job involves lifting heavy things or carrying things from place to place, they will teach you how to lift. It's not just bending and lifting something heavy. You understand? One has to be very, very careful that you bend down to lift something heavy rather than just pick something up from straight away. You understand? So I'm sure because of health and safety, most workplaces now have to ensure that if your job involves lifting heavy stuff, you are trained on how to do that to prevent you from having severe back pain. Okay? But obviously, most people drive to work. Most people now, it's an information technology age. People use the computer a lot. So it's quite important that you invest in having a good chair, because if you don't do that, then if you sit in a funny way, that can affect your back on the long term. And believe me, you don't want to have a back pain because obviously that can affect you even driving, walking to work, being able to even walk. You understand? So there are two main types of back pain. There's what they call lumbago, which really affects the muscles of the back, the lower back. So the pain is just within the lower back, so you won't be able to do things. But if you take painkillers like ibuprofen or paracetamol, after a few days it should go. Or if you kind of have a good massage with things like deep heat, the pain should go. Or things like aboliki, the African, that too can help for pains like that. But that is the muscular pain. Okay. And there's what they call sciatica, which I feel is the most common. The pain will start from your back, but it will go all the way to your neck. You understand? That's the kind of pain you don't want to get, because that can make you, you won't be able to do anything if you have that pain. You understand? And most painkillers don't treat this sciatica, but from experience, if people complain of this sciatica pain, I would advise them to take something that's got caffeine in it. So things like paracetamol extra, there's what we call sopadine that we sell. Those are good for those kind of pain. But if you just take ibuprofen, it's not going to work. If you take things like even cocodamol itself, it won't work. It may remove the edge, but you still be feeling the pain, because it's a nerve pain. It affects the nerve. So you need something that kind of works on the nervous system, basically. So that's why I always go for that. People always come out, that painkiller, the painkiller the doctor gave them didn't work, and because the doctor hasn't distinguished between the two kinds of pain. You understand? So it's quite important. So if you're taking a painkiller for a kind of pain and it's not helping, the best thing is to go back to the doctor, let them know that what they've given you hasn't worked, so that it can make them to rethink of what they diagnosed, basically. And you know that in pain generally, if you have a severe pain for a long period of time and you're taking medication for it, if it's not working, then there must be a problem somewhere. So I always advise people that rather than just taking painkillers, it's best to go back to the doctor so that they can do further screening, because it could be an underlying chronic condition which the doctor has missed out. You understand? So it's quite important that if you have any pain over a long period of time and it's not being relieved by normal painkillers, then the best thing is to go and see your doctor.
Yes, sir.
Yeah.
Want to see something?
Yeah.
this pain you are talking about, I got it nearly 1 year.
Okay.
Yes, but it caused. I tried painkillers, doesn't work. My GP, they sent me to St. Thomas Hospital. Nothing works. I experienced that it's the shoes that I wear to walk, doing patrol, going up and down, up and down. Immediately I changed the shoes because the one I was putting on had heel.
Okay.
Then I started putting the soft one.
Yeah.
Then the pain vanished from that time to now. Yes. Then I went back to my GP. I told him that I explained to him because they don't know. Yes. I started complaining this, complaining over and over and over. They sent me to a big hospital. Yes. But immediately I changed the shoes. Yes.
Yeah,
I wear that soft one.
Yeah, the soft one.
Yes. The pain started going down.
Yeah, that's why even with shoes,
Yes.
it's very important because the nerve is from the leg up to the back.
Yes.
So if that is affected, it would affect your back.
Yes.
You understand?
I was getting that pain.
So that's why I'm always advised that your shoes should have, especially if your work involves walking a lot or standing a lot. Make sure the shoe has a soft padding on the inside.
Yes.
So for me, because of the kind of job we do, we stand a lot. Some people try and wear a very smart shoe, but sometimes the smart shoe is not the best because inside the shoe is very hard. The soles are hard.
Yes.
So if I know I'm going to stand a lot, I always go and wear a soft shoe inside. So that way it just prevents me from getting any pain, any sort of pain. Okay. So, do you have any questions? Okay. So in terms of treatment of pain, like I explained earlier, we've got for tablets, the key ingredients in most tablets in this country is either paracetamol and NSAIDs. NSAIDs include things like ibuprofen and diclofenac. Most painkillers have paracetamol in them. If you look in there, it doesn't matter what the name of the thing is. It could be an Adin extra, it could be Bichas. Just have a look. Just check the ingredients. It's paracetamol, and that's what helps to relieve the pain. And how the paracetamol works is, you remember the prostaglandin, which I showed to you earlier. This prostaglandin here. So what happens is when you take the paracetamol, the effect of that prostaglandin kind of combats it, so that you don't feel the pain. Okay. So that's basically how it works. So that's like I said. So it acts by inhibiting that prostaglandin, and that way the brain doesn't feel the pain. Okay. So as time goes on, the pain will just resolve. But the negative side of paracetamol is it doesn't help with swelling. So if, for instance, you bruise your knees and it's swollen, then it's best to go for something like ibuprofen, that helps for the pain and also reduce the swelling. Okay. So things like ibuprofen, diclofenac, aspirin, yes, but personally I don't recommend aspirin. And the reason why I do that is because aspirin is the side effects is very harsh on our stomach. You understand? And though it's good, but for me personally, I would rather give ibuprofen or paracetamol than diclofenac. But aspirin, from my experience, is because of the harshness. And then some people are asthmatic, it triggers their asthma. People that have got ulcer, a lot of people from ethnic background, they have stomach ulcer. So if you give them something with aspirin, it will only make it worse. So you're solving one problem, but you are causing another problem. So I always advise that if you're taking any painkiller, and though usually it's recommended for a short period, but I always go for things with ibuprofen if you want to take something that helps with swellingness or inflammation. And they work at the site of the pain by reducing production of the prostaglandin, and the tissues surrounding the area also helps resolve the pain there. Okay, but this should be used in conjunction with asthmatics or people with stomach ulcer, like I said. Okay. there are other painkillers available, which are they are all combination of the two I just mentioned. So you find things like Manadin Extra that has paracetamol, aspirin. Some of them have caffeine in addition to that. So all the painkillers, they just mix and match most of the things and just give it a different name. Okay. But then there's the combination with opioids, what we call opioids, so things that contain codeine and dihydrocodeine, right? So, I'm sure you would have heard codeine some people find it very addictive. So that's why we are very strict when we want to sell it. So if you just come and say, I want to buy Cocoa Damo, they will ask you 1,001 questions before we sell it to you. You understand? But it's just to establish that you've used other painkillers before trying that. And secondly, to check that you're not abusing the codeine. Because some people take it because it makes them sleep, and which is not right, to be honest. There are other sleeping tablets we could sell. Okay? And also with the codeine, some people experience having constipation with it. You understand? So obviously while we're questioning, we also check on that to see if they've used it before and if it's caused them any problem. But you have to bear in mind that the codeine causes drowsiness, but it is very good for very severe pains. Okay, so whatever pain when you come to us, we'll ask you questions to establish the kind of pain, and then from there we'll now recommend either from each of the things I've mentioned. Okay, and there are some painkillers that have things like caffeine, which is what I said, which is good for sciatica. And things like antihistamine, so doxylamine, that's for like a muscle relaxant. So I don't know if anyone have heard of Sindor before. Sindor is good for tension headaches. Okay, but I think at the moment we can't get them at the moment. So and there's Panadol Night that has the diphenhydramine. So for some people that cannot sleep due to the pain, you can give them something like that. Okay. And also the painkillers also come in gel form now. So like if you have a sprain, if you don't exercise and you're having pains in your thigh or anything, you can buy the gel and just apply that on the site where the pain is. You understand?
Is it as effective as the?
Yeah, it is as effective. And also there's a reduced risk of side effects as a result of you using the topical one as opposed to taking the tablets. Okay, so we always recommend that you use the gel where possible. But if the gel is not working properly, then you can now go for tablets. Okay, and there's what we call robefacents. So that's things like aboliki, deep heat. So how that works is when you apply it on your skin, it burns your skin. Okay, because it burns your skin, it takes your mind off the pain. So that's how that works.
Okay.
That's all it is. There's no mind. It doesn't treat it. But obviously, because the body will repair itself with time. So what you're doing is you're taking painkillers just to take your mind off it. But the body will repair itself. And like the paracetamol and ibuprofen, because it also inhibits the prostaglandin, it prevents that swelling that is there and the damage in the tissue. You understand? So something like this things like aboliki, for instance, it only just takes your mind off it. That's all. But the problem will still be there. You understand? But that's why you have to apply it frequently. Some people will say, "Oh, that's the magic that is helping me," but the problem is still there, unfortunately. So, but they do help, especially when you use it to massage like a swelling and stuff like that. And there's heat therapy. So there's now available. They've got like heat patches. There's gels that you can put in the microwave, to heat it up and put it on your wherever the pain is. The same principle. It only takes your mind off the pain. You understand? Some people use hot water bottles. They put it on the back. It's just those things just remove your mind from the pain. You understand? And like I said, pain is subjective. So long as, for some people that's what works for them, that's it. So you give them that. So the cool therapy is just using like ice or any gel that would cause you to have coolness. Okay. And then there's the pulse electromagnetic field technology. So those are machines that you put the pad on to where the pain is, especially people that have back pain. I think they use that a lot. It's like a tense machine, and that transmits the waves that helps relieve the pain. Okay, so those are just new technology coming out to. So instead of you taking painkillers, some people they've tried them on so many painkillers, they now use the pulse technology to help with the pain. Okay. Does anyone have any questions?
From what you said now, is it okay, because I challenged somebody before, is it okay for you to take paracetamol and another pain?
Yeah, combination, you have to be careful. So something like paracetamol, you can take it with any NSAIDs. NSAIDs are things like diclofenac or ibuprofen. You can take it with paracetamol.
Okay.
But personally, I would say take one or the other. The whole idea is you don't want to take too much of something and you won't know which is working for you.
Yeah, that's why I was confused, because actually it was my friend. He was giving her daughter maybe like 4 hours we give him paracetamol, the next 4 hours or 8 hours is giving that. So I'm thinking that why not give him one instead of combining the two? And they said his GP said it's okay. I said okay, fair enough.
It is safe enough, especially so long as the person has seen the GP. Because what we don't want to do is, you don't want to, especially with kids, you don't want to max the problem. So what happens is, if they have like temperatures or they have a complaint of pain and you give them painkillers over maybe 2-3 days, if they're still complaining of that problem, then the best thing is to take them to the doctor. The doctor will check them and make sure there's no other problem before recommending something like that. But because with kids, it's quite important to keep that temperature down so that they don't get to go into like a fit or anything like that. You understand? So that's why they recommend to use something like that. Okay. But as adults, I would advise that we take one or the other, so that you can now tell which of this tablet works for you. You understand? Right?
That's a sometimes if you have a long headache and the tablet that you can use for 12 hours, because long pain lasts. For 12 hours.
Is it ibuprofen or? It depends on what is in there, but I'm sure it's ibuprofen.
It's not ibuprofen, it's different. It's a painkiller.
Do you get that from your doctor? Or?
No, I get it in Sainsbury.
That's what I'm saying. It's one of these two. You can't really, that's what I'm saying. If you look inside it, check what it contains. The name of the tablet doesn't matter. It's what it contains that's it's either ibuprofen or.
Because it's work for me. Because it's a long. No need to take on that one. Just 12 hours.
12 hours. Yeah. If that's what works for you. But like I said, you try and identify what is causing you to have that headache and try and avoid it. So, but if you do have the headache, then you have to treat it there and then. So if that's what works for you, so long as you eat something before taking it, I think you'll be fine.
I eat first before I take tablet. But the tablet will not work.
I'm going to say, mention something about the side effect of taking painkillers regularly.
Yeah, I mentioned it earlier. It's called overuse. That's what causes overuse headache. It's one some people, because they have pain, they take painkiller. But before their body, once the painkiller wears off, they start developing headache. Why? Because they're taking too much of the painkiller. You understand? So that's why we encourage people to just take painkiller when they need it. And some people, because they have like chronic problem like arthritis, they have to take painkillers. You understand? But we always tell them to advise them to take it when it's necessary. You understand?
Does medication misuse have any role or influence on the liver?
Of course. Things like ibuprofen affects the kidney, definitely. So that's why personally I don't encourage people that take ibuprofen. Because doctors now, once you have a chronic pain, they just place you on naproxen, diclofenac, ibuprofen. You understand? So I always counsel the patient and tell them, you know what, paracetamol is the safest. Okay, paracetamol is mainly metabolized by the liver. Okay, but if you take it in moderation as prescribed, it's safe. You understand? But ibuprofen can affect your kidney. So that's or any NSAIDs, they affect the kidney. So I always advise them to take that only when it's necessary. You understand? And apart from affecting kidney, obviously those NSAIDs also affect your stomach. So you might get things like stomach ulcer in the process of taking them. So one has to, be very careful. Some people are not aware of it, but we let them know, and then they now say, okay, they have to now be cautious. Some people, when they come over, they say like ibuprofen, now they say they took 2 tablets. Maybe the tablet they give them was high dose, and they say, they took and 2 will work for me. But in terms of the long-term effect, that's what, I'm personally always worried about long-term effect of something. You might not feel it there and then, but if you keep taking it like that, it could result to you having kidney problems in years to come.
So is it not true to say that? Because people will say at times, especially maybe, for example, in courts, maybe immigrants or something like that mostly if you go to the GP and they prescribe medication or whatever, and they give you all those medication because they want to shorten your life. I don't know. So is it true then?
No.
Because why are they prescribing it if they know the side effects in the long run though, and they kept repeating it and giving it to people?
Yeah. The thing is, doctors follow what they call NICE guidelines. Okay, so if this is how they prescribe, if you fall into a category of problem, the doctor will prescribe based on what is being recommended. So for people that have things like arthritis, right? Because with that, it's quite common, but most people don't. As you grow older, especially once you hit 50, you begin to have problems like that, the limb pain and all that. For them, it's cheaper for them to prescribe painkillers for you to use, as opposed to you going to do a surgery. You understand? Obviously, initially it won't start at a stage where they will say you have to do surgery. It's when it gets bad that you cannot do anything. Then that's when you might have to do surgery now or something.
But in essence, why not that? Like giving the pros and cons of, and if you went to a GP to say you're having this, before they prescribe any medication, even though that's the kind of medication, because I believe that some might be maybe lesser, even though probably maybe cure the something or react immediately. They should be giving the patients the opportunity of something like pros and cons. This is the advantage of this if you take this, and this is the disadvantage of it. Maybe, especially if you are going to be on it for long time, so that people could be able to make decisions as to what they want to do.
You're right, but unfortunately, I don't know if you've been to the doctor recently. After within 2 or 3 minutes, they're out of the door. You understand? So they just ask, what's your problem? Whenever you say it, some doctors who are very conscious of their job, some doctors, people are different. If I don't know, but from my experience with few, I know that with like Nigerian doctors, for instance, they will tell you, especially if they know you're from Nigeria, that
exactly,
they will tell you straight away that you don't need this, But if it's like the way, if they have to follow their guidelines, then they will just give you what they, and it's not up to you to decide if you want to take it or not. They expect you to go and read the leaflets. If you go to the pharmacy, the pharmacists are supposed to advise you too. Unfortunately, some pharmacists are too busy. So all they do is once you give them your prescription, they give it to you, there you go, and bye-bye. You understand?
So is it advisable then to go on the internet then to check for the disadvantage or advantage or causes or something of the medication you've been prescribed with? Is it good then?
That is the age we are at now. But the thing is, what I will not advise people to do is go to internet to kind of diagnose themselves.
No.
But if you want to find out more information of what you've been told you have, it's even the best thing. So that when a doctor gives you something, you can challenge them. You understand? It's quite good, and I always encourage that, because sometimes even the doctors, because they are tired, they just prescribe anything, and that's why for me, if I notice something doesn't look right, I always double check with the patient to make sure this is what they really want. You understand? But if for instance we're so busy we don't ask you, you just end up taking something for life, and it's causing you more harm than good. You understand? So it's always good to, as a patient, because you are the one taking the tablet at the end of the day. So whatever tablets we give you, it's best you read about it, find out what it's all about, and see if it matches what you're taking. And if you're not clear about it, then you have every right to go back to either the doctor or the pharmacist to tell them to give you more information about it. You understand?
And to listen, to kind of pay attention to yourself.
Exactly.
See how you feel when you take something.
Exactly.
Maybe there's a difference positively, negatively, then you should.
Because gone are the days where they will say the doctor is king. Now, the way they are encouraging consultation, they want it to be an agreement between the patient and the doctor. So if a doctor prescribes something to me, I have every right to tell the doctor, no, doc, I don't think this is right for me, give me something else. And the doctor will do that, you understand? But it's only if the doctor is having a bad day that you understand? You understand? So that's very good. But I think it's quite, especially now with the way NHS is going, I advise people to educate themselves more. If you are not clear about, especially if they say you've got like hypertension, diabetes, anything you are taking, if you are not sure about it, double check with pharmacists. Or even if, maybe at that point in time, if you haven't got time, tell them